Bismillahirrahmanirrahim. Assalamualaikum, selamat sejahtera and good evening. So, I'm Dr. Abdul Hadi bin Anwar. I'm a general surgeon from Hospital Haji Puan Zainab 2, Kota Baru, Kelantan, and currently in fellowship training subspecialty breast and endocrine surgery. So, my topic is type of thyroid malignancy and risk factor predicting thyroid malignancy and lymph node positivity 7-year single institutional review. Okay, background and the incidence of thyroid malignancy basically increases and varies according to centers. It's around 5 per 100,000 up to 25 per 100,000 per year. I'm presenting the data from our center. We are trying to utilize our high volume thyroidectomies data in our center. So at least we have have insight on types of thyroid malignancy and some certain clinical pathological profile predicting thyroid malignancy and lymph node positivity. So it's a retrospective review 7 years, 2017 to 2023. It's a single endocrine surgery referral center in East Coast, Kota Baru. Basically, all the thyroidectomy performed by 3 endocrine surgeons. The inclusion criteria basically all thyroidectomy. That means that all benign and malignant case that underwent thyroidectomy done by 3 endocrine surgeons throughout this 7 years. As you can see, the duration is quite unique because 2017 to 2023 means that it's a pre-COVID, during COVID and post-COVID. Data on demographic and clinical pathology obtained from database and univariate analysis done to assess the relationship. So from my study, the finding were the median age is 48 years old. Majority are female, and around 50% is elevated, having a thyrotoxicosis, high thyroid function test. The mean weight is 112 gram, and among 592, there's 32% of all the cases were malignancy. Looking specific into the type, basically it's almost the similar type with other study. Giving the types of thyroid cancer is difficult. Even from 2000, there's 2 changes of WHO classification from 2017 to there's one in 2017 and there's one in 2022. So, but basically, in general, for the well-differentiated thyroid cancer, papillary thyroid cancer is the most commonest. What I want to note that there's 43 cases of micropacity, means that those we presume benign, but it turned out to be malignancy, but it's a micropacity, it's a papillary thyroid carcinoma which is less than 1 centimeter. And there's some special type which carry responses but rare. But the only univariate analysis shows that increased age has a higher risk of malignancy. Being a male, higher risk of malignancy. Actually, the bigger the thyroid, the heavier of the thyroid, actually is reduce the risk of malignancy, and having a thyrotoxicosis reduce the risk of malignancy. As far for predicting lymph node positivity, being male has a higher chance, higher risk of malignancy. I think my conclusion is this data provide at least available data on distribution of thyroid malignancy and distribution of subtypes, which in our setting, local setting, lack of data. Risk factors in predicting thyroid malignancy was consistent with previous study. However, predicting the risk of nodal positivity is more challenging and more data needed. Thank you.
Thank you, Dr. Abdul Hadi. Are there any questions for Dr. Abdul?
Hi, Doctor. Why do you believe that females are experiencing the higher rates of this cancer?
At this moment, we are quite not sure, but just to note you, actually female is more common to have a malignancy. But if the patient is a male and have a thyroid swelling, there's a higher chance the patient is having we are more worried that this patient might turn out to be a cancer. But as far as whether female or female, so far, at least on molecular basis, we don't have much data to show why female is more common than female.
So if it's a guy and it's enlarged, you're sure, but if it's a woman, you're not that sure. It's a big area where you're not sure, but it's a high risk. Is that what I'm understanding?
Woman is more common to have a thyroid malignancy,
Right.
but if a patient come and he's a male, we
You're
might
sure?
want to think this is higher risk of
Okay.
getting cancer.
I think what Dr. Abdul is trying to say is like, the thyroid gets enlarged for a number of reasons, right? So if a female patient comes with a swelling, it might be a number of reasons,
Yes.
right? Including malignancy. However, if a male patient comes with an enlarged thyroid, the first thing on your mind is malignancy, right?
Yes.
Yeah, okay. Anyone else have a question? Okay, I think we can move on with the third presenter, Dr. Koh Hui Ying, talking about trends in early breast cancer surgery.